In this video, I'm going to talk you through the schedules module within Complete GP. So if we navigate over here to the left-hand side and click on workflow, we can see we have this schedules tab. So the schedules module is a system which we developed which makes it really easy for you to identify patients who should be coming into you on a recurring basis or on some kind of scheduled basis. And then the system makes it very easy as well for you to automatically book these patients in and to communicate with them. So the best way to see this is through an example. So you can see when you navigate to the schedules module, you've got a large number of template schedules already created for you. So we can see we have 3 pages worth of them there. And of course you can click over here on the right hand side and you can create your own schedules if you wish. So what I'm going to do is I'm going to use the CDM program as a sample to demonstrate this, what it does. So if I just type in CDM, I can see that we've got a schedule here for the prevention program, for opportunistic case finding, and for the treatment program. So in essence, what I want to do is, let's take the CDM treatment program as the example. I want to be able to identify all the patients within my database who could potentially be eligible for CDM. And then I want to make it very easy to book them in initially, but then to also make sure that after their initial visit that they've been followed up for their interim visit, and that every year we're getting onto them for their annual visit again, etc. So that we're never missing, we're never forgetting to contact them, we're never forgetting to book them in, that there's a system in the background which is doing all that for us. So if I click in here, if I right click on it and I go to update, here I can see what the settings for the schedule look like. And again, these will come all pre-configured. You can update them, but they'll all come pre-configured for you. So I'm not going to click into everything here because there's quite a bit going on, but there are some bits that I feel are quite important. So the first thing is the timing. So this shows you the underlying rule set that you can put into the system to make sure that people are being contacted in time and being booked in at the right cadence. So you can see this is a continuous schedule. So that means once you're in the CDM program, unless you are actively removed from it, it is something which goes on continuously year after year. We can obviously have renewing schedules and finite schedules again. So a renewing schedule might be, for example, the influenza vaccine, which renews each year on a yearly basis. But let's just stick with our continuous one for the moment. So the types of rules we're putting in, we're saying that patients must have a 4-month gap between visits, that they can have a maximum of 2 reviews within any 12-month window. Okay, so they're the underlying rules that have to be adhered to for the CDM program. We can click into booking here. We can say that we are happy for our schedule to book patients in. So that does not necessarily need to be yes. You can book them in manually if you want, but we are going to say that we're happy for the scheduler to book patients in. Auto book I'm going to demonstrate to you. So auto book is basically where the system will automatically find the most appropriate time slot for them and book them in and communicate with them in the background, send the emails and SMSs that you have set up in the system that should go to a patient when an appointment is booked. And then there's things like avoid overlaps, how many minimum days notice must we give them prior to booking, and loads of different settings like that. For the example which I'm going to do for you, I'm going to show you that we are going to set up our CDM as a 3-stage visit process. So we're going to have step 1 visit, which is the blood clinic. Okay, that's going to last 10 minutes, and that should be at its earliest possible convenience. Then we're going to have a nurse review, and that's going to happen a week after the blood clinic, and it's going to last for 20 minutes. Then finally, we're going to have a doctor review, and that's going to last for 10 minutes. Okay, we can see here that we can configure what messages go out either by email or by SMS to the patient. Again, those can all be customized if you wish to change them. Then after that, I'm just going to briefly show you how we can again tweak how the patient actually finds these patients. So we can say that, okay, we need to find patients that are active in our system. We can say we want to find patients that in this case are more than 18 years old, as we can see here. We can say that the patient needs to match any one of these coded conditions, etc. So you can build up your conditions like that. You can have many different entry routes into the program. And again, this can all be configured, but we'll have this all automatically set up for you. Okay, so I'm going to cancel out that. We don't need to change anything. That's just showing you the background behind it. So now we have that set up. So now our system knows what the CDM entry criteria should be. So all we're going to do is we're going to right click here and we're going to click on View Candidates. And what this is going to do is it's going to search our database for all of the potential patients who would be eligible for the CDM program and who are not already within our CDM program schedule. So in this case, it's found one patient, it's found John Test, and we can see here that the system tells us why they're being presented to us as an eligible patient. We can see that they are not already listed in the treatment program. They have a chronic disease. The patient is active. They're not deceased. They're aged 18 and over, etc. Okay, so the system is telling us there, it's giving us a snapshot as to why that patient is being presented. You can, of course, you can view the patient and check them out yourself. And then once you're happy, you can select one or all patients if you had multiple ones being identified. This is a test system, so of course the number will be a little bit smaller. And then once you're happy that this patient should be part of the CDM program, all you do is you select them and you click on Add Selected. Okay, so I've added my selected candidate to the CDM schedule. So now if I go to Patients on Schedules, I can see that John Test has now been added to the CDM program schedule. They're active within that schedule. The next step for their CDM journey will be the registration visit. And it is giving the next due date as the 15th of July 2026. Okay, so, and again, it's giving us the reasons as to why they are why they're in this schedule. It is also showing us that they are not currently booked in for this visit, that they don't have a visit booked in for a CDM, and that as of now, AutoBook is turned off for this patient. So I'm going to show you now how easy it is. So this is basically where you will identify all the patients who over, for example, the next 20 days or the next 10 days or next 30 days are due to be with you. So you can filter this down by date and say their next who's next due within the next 30 days, and you can look at this table here and identify, well, are they actually booked in or not. So you can see that this patient is booked in, this patient is booked in, but these patients are not. Okay, so if I now wanted to correct that and say, okay, well, I would like John to be booked in for their CDM visit, all I do is right click. I can obviously open the patient file to view them, I can email them, I can SMS them, but the important one here is I'm going to click on Auto Book. So if I click on Auto Book now, you can see that as quickly as that, their booked for status has changed. So now they are booked in for the 22nd of July 2026. And I'm going to demonstrate to you in a moment in the calendar system that will have created the 3 separate bookings for them as we had set up in our schedule. So the blood clinic, the nurse review, and the doctor review. And of course, if you needed to, you could always rebook them if you need to move the dates, etc., or you can do that directly from the calendar. So now basically what you want to do here is you want to make sure all your upcoming patients are booked in for their visits, or of course they might not want to be booked in, but at least you can see that information here, and that's as easy as that. So now if I go to my calendar, I'm going to see what John Test has here. So if I go into my calendar and I'm going to go for an appointment search, I'm going to search for John Test. Okay, I think there's a number of John Tests. I think it was this one here, and you can see that they have 3 visits now. So on the 22nd of July at 9 o'clock, they are booked in for the CDM blood clinic. A week later at 9 o'clock, they are booked in with a nurse in the system for the nurse review. And that same day, 20 minutes after the nurse visit, so once the nurse appointment is completed, they're booked in with their doctors. That's the doctor they are registered within the system on their file for their doctor review. And all of those visits are modifiable in the calendar, etc. from that point on, or we can go back to the schedules module and rebook them as I just showed earlier. So this is just a very quick insight into the schedules module. In overview, it allows you to identify patients who should be coming into you on some form of planned or scheduled basis. So this could be as complex as CDM, or it could be as routine as everyone whose blood pressure meets a certain criteria should be coming in for a checkup once every 6 months or once a year. Okay, so whatever schedule you like, we identify the patients that should be coming in, and then give you a really easy visual overview of what patients should be coming in to you, and are they booked in or not. And if they are not booked in, you have that ability to just auto book them, or to manually book them, of course, as I showed a moment ago. Okay, so this is the schedules module within Complete GP.